All right. Hi, everyone, and welcome to the second webinar in our Language Access Planning series on developing an effective language access plan. We are so excited to be joined by Lumari, who's a project manager at the National Latina Network for Healthy Families and Communities. And so Lumari is an expert in Latina youth development and advocacy, community leadership and engagement, language access, organizational development, and implementation of culturally responsive interventions that target Latina communities. So we are in good hands today and are excited for you all to be hearing from Lumari. So at this point, I'm going to turn it over to her. And as we said, if you want to type any questions into the chat box, we'll be able to answer them either as we go through or towards the end of the webinar.
Good afternoon, everyone, and welcome. Thank you, Jackie, for that wonderful introduction. I greatly appreciate it. And thank you, everyone, for joining us this afternoon. I greatly appreciate it. You taking time out of your busy schedules to join us to learn a little bit about language access planning. Just a few things before I start. Just wanted to share with you that if you had a chance to look at the PowerPoint, you'll see that there are a lot of slides. And so I'll be presenting quite a bit of information in a very short amount of time. And as a result, I'll be moving through these slides pretty quickly. However, we wanted to make sure that you at least have as much written information on how to develop or start thinking about developing your language access plan with you after this webinar is over. And so, like Jackie mentioned, please do stop me. And if you have any questions, just type them in the chat. Jackie will go ahead and keep an eye on those for me and kind of prompt me every so often to make sure that I'm able to answer your questions in real time. Also, given that I am going to try to cover a lot of information, we're also going to be hosting a call next Monday. It'll be a Q&A, primarily to answer any additional questions that you all might have about language access, and particularly how to get started on developing your plan if you haven't done so already. Also, if you do have a plan and you're looking to enhance it, just being able to provide some training, some TA, and being able to answer those questions during that call next week. So if for some reason I'm not able to answer your questions during our webinar today, I'll certainly do my best to at least provide answers in written to Jackie, and she can send those out to the group. Or if we're able to join us on the call next week, we might be able to address them there as well. So a couple of things. Today I'm going to be providing an overview of a few things. First would be the federal requirements pertaining to the provision of language access. Also, we're going to be taking a look at what it means to take reasonable steps to providing meaningful language access. And then I'm going to take you through a really high-level overview of the information gathering process, really looking at the different components that you'll want to be thinking about, the information that you want to be gathering in preparation for starting to draft your language access plan. If I get a chance, I'm also going to walk you through one of our tools, the LEP toolkit that we've put together. And it's a very comprehensive toolkit. It'll help you to either start a plan from scratch. It'll take you step by step through all the thinking, all the documentation that needs to happen. It provides you a template of a language access plan and tons of other resources. And the same toolkit can be utilized in the event that you have an existing plan already. It'll take you through the process on how to enhance that existing plan. So I hope to get that by the end of this webinar. If I don't, I encourage you to visit the LEP toolkit. I've provided the link on the PowerPoint so it's easily accessible to you all. Like I mentioned, go ahead. If you have any questions, pop them in the chat, and we'll go ahead and take those as they come. So to get started here, before we jump into developing a language access plan and getting familiar with the why we need to have a language access plan, looking at the legal requirements and just at the moral and ethical part of our work, right, around ensuring safety and ensuring the safety and well-being of the survivors that we work with. I want to get a feel for all of you who are on the call as far as where do you feel, or where do you feel that your organization stands when it comes to providing meaningful language access? Is your organization one that has a plan already? Have you started having these conversations? So in your chat, if you could just type in your response to where does your organization stand? Are you unsure, which is perfectly fine? If you're not clear where the organization is, are you at least starting to have conversations around it, about the importance of providing meaningful language access? Are you working on a plan? Do you have a plan? Are you looking to enhance a plan? Have you implemented a plan or are looking to revisit it to see what things need to change, etc.? Okay, so right now from the responses that I've gotten so far, it looks like a lot of you already have a plan and are looking to enhance it. Okay, perfect. And so we'll talk a little bit about this. So some of what I'm going to share with you today is the thinking behind preparing yourself to develop a language access plan, but these same steps also pertain to those of you who are looking to enhance, especially if you haven't had an opportunity to be an integral part of the team that actually put your language access plan together. So it'll be very helpful for you either way. So thank you for responding to that. I greatly appreciate it. So let's get started here. So we're going to talk a little bit about who are individuals with limited English proficiency. So individuals with LEP, limited English proficiency, are those individuals who do not speak English as a primary language and who have a limited ability to read, write, speak, or understand English. We've learned that many individuals with limited English proficiency are in the process of learning English and may read, write, speak, and understand some English, but not proficiently. So something to understand as remember as we're doing this work around language access, right? Oftentimes as advocates working in the field or in our organizations, we might come across an individual with limited English proficiency, someone whose dominant language is not English. However, the way that these individuals might present themselves oftentimes makes us believe or feel that sometimes they might be able to understand the English language. And so we need to be very careful in those situations, right? Something that we like to keep in mind as a best practice is that when you're working with individuals with limited English proficiency, that it's best to err on the side that although they might acknowledge that they might understand what we're saying to them, that they acknowledge that they understand the English language, we need to be very mindful that because they might be saying that they understand doesn't necessarily mean that they're comprehending exactly what we're trying to communicate with them. And so it's very important to remember that we need to be able to ensure that we provide meaningful language access to these individuals, whether it's by way of an interpretation line, a telephonic interpretation line, or possibly an in-person interpreter, and we'll talk a little bit more about that, or even if you have bilingual staff within your organization, providing opportunities for that individual to be able to communicate in the best way possible for them, and also giving yourself the opportunity to communicate in the best way possible for them. So it's really important to remember that they do not speak English as a primary language, but have a limited ability to read, write, and understand. It is critical to the work that we do. So who are the individuals with LEP? So recently, the trend has been that with the rise of immigration and the shift in the U.S. settlement patterns over the past 15 years, means that we're encountering more and more communities around the country who are facing challenges working with individuals with limited English proficiency, and not just in our field, but in the medical field and the educational field. We're seeing this all across the board. When we take a scan of individuals across the country, and this is data that's provided by the CDC and the U.S. Census the most recent one that was conducted. What we've learned is that the U.S. Census has identified 6 states with the highest number of individuals with limited English proficiency. So the state of California, the state of Texas, New York, Florida, Illinois, and New Jersey account for about 68% of the total limited English population within the United States. And also what we've been able to learn from the census is that the majority of those individuals are Spanish-speaking individuals, which is very similar to what the data shows there in the state of Pennsylvania, and I'll be sharing that with you here in just a second. And so here what we can see is that the 21% of the population in the United States over the age of 5 years old speaks a language other than English in the home. And what we also know is that the language spoken in the home is a great indicator of who may qualify as individuals with limited English proficiency. So this is data that's collected by the U.S. Census Bureau, but locally it's also collected by your school-based your school districts. Your school districts usually do a student survey every couple of years, and they collect this data. And based on this data, they're able to predict, the number of students coming into their school systems with limited English proficiency, helps them develop the programs that they need to develop to support those individual students. So it's very important to understand that this data is not only collected on a national basis, but it's also collected on a local level by your local school district. And so now when we're looking at languages spoken in Pennsylvania, we can see that of the 11 million people in Pennsylvania over the age of 5 years old, 4% of those folks speak Spanish, with 1% speaking German, and this includes Pennsylvania German. Also, 0.5% of the population speaks Chinese, and 0.5% of the population speaks Italian. And according to demographic data that I was able to locate in Pennsylvania, foreign-born Pennsylvanians are largely from Asia, so about 36% of the Pennsylvania population is from Asia, with 36% being from Europe and 31% from Latin America. And then the majority of Hispanics are of Puerto Rican descent, having one of the largest and fastest growing populations in the country. So why provide meaningful language access? Why is it so important for us to be able to do that? Well, there are a couple of different reasons. The first reason being it's a legal requirement, right? So for any program that receives any federal funding from the federal government, you are required to provide meaningful language access. And we'll talk a little bit about what meaningful language access means, right? Because that'll look different for a smaller DV serving organization, or it'll look different for a statewide coalition in terms of what is meaningful for your program in your community. So we'll talk a little bit about that. But then also what we learn is, on the moral and the ethical piece of our work is that, frankly, it's the right thing to do, right? We all have a responsibility.
Mute off.
During the access to critical services for survivors with limited English proficiency
All guests
is
have
available.
been muted.
One of the ways in which we can ensure access to critical services is by making sure that we each have a documented language access plan that clearly outlines the steps that our organizations will take to ensure meaningful access. So what we do know is that for many of our organizations, we're already providing language access, right? By way of the practices that we employ within our organizations. What do you do when someone who's limited English proficient calls your hotline? What do you do when you have a survivor who comes to shelter who might be limited English proficient? For many of us, we already have practices in place. What we're trying to do by following this process of developing a language access plan is we're trying to put those practices into a formal written document, into a plan. And that plan will not only guide us in our provision of language access, but it also provide information to those, who come to us wanting to know what kind of services we provide. It also provides opportunities for us to outline who will be responsible for what in terms of language access provision. It'll also highlight, for example, how we would train our staff in doing some of this work. And, as organizations who are really dedicated to supporting survivors, we're all committed to ensuring the safety, healing, and justice for those who have been harmed by violence. And as such, it's really important that we invest in being proactive. And by having a language access plan, we're able to ensure that survivors are able to access our services in meaningful and equitable ways. It's important for us to recognize that how the lack of a proactive plan for meeting language access needs of individuals with limited English proficiency can undermine meaningful access to those services. It can ultimately compromise their safety and the options that may be available to them in seeking safety and support. Meaningful language access clearly enhances safety if you consider that without it, individuals cannot interact fluently with advocates, service providers, law enforcement, and other systems. And so what I wanted to share here with you right now as an example of why it's important for us to provide meaningful language access is the story of this young woman here, Daisy Garcia. And Daisy Garcia is a survivor. Well, she's actually been a victim of homicide. But Daisy was a victim of domestic violence in the Bronx, New York. And Daisy had actually made multiple reports to the NYPD around the victimization that she had encountered and was dealing with in terms of being a victim of domestic violence. She had filed multiple reports with the NYPD. All of these reports were taken in Spanish. The challenge here is that the NYPD did not follow through and have these reports that were taken in Spanish translated into English, which meant that there was not adequate follow-up with Daisy and her case on those separate occasions when she came in to file these police reports, indicating that, she was fearful for her life, she was fearful for the life of her daughters. Her husband at that point had made multiple threats to hurt her and to hurt her daughters. At the end of the day, what happened is that her husband ended up killing Daisy and both of their daughters. It didn't come to light that she had filed police reports onto her family after she had passed. Her family had been cleaning up her apartment and gathering her things when they came across the 3 police reports that had been filed in Spanish. And as a result, a lawsuit was brought up against the NYPD by a local Latina serving organization in New York, demonstrating the lack of language access, of course, at one of the nation's largest law enforcement agencies. And just recently, I want to say last year, this TV serving organization actually won the lawsuit against the NYPD. In terms of their inability to provide meaningful language access to Daisy in this situation, and how had the NYPD had a language access plan in place, had they had the necessary protocols in place and what to do when a report is taken in Spanish or in a foreign language, how those reports are translated, how that information is shared and followed up on. And so it really has brought to the forefront the importance of ensuring that we all in this field, whether you're a DV service provider, a law enforcement agency, prosecutor's office, any service that receives federal funding from the federal government has that responsibility to ensure that this doesn't happen again. And I think at the end of the day, this is why we provide meaningful language access, right? It's not just another thing to add to the list of the myriad of things that we have to do every day. It really is about ensuring the safety and well-being and the livelihood of survivors with limited English proficiency who come to us seeking services. It's really ensuring that we're able to provide access to those services in a way where there is parity and in a way where there is equitable access to those services. So we talked a little bit about this being a legal requirement, and it is. As outlined by Title VI of the Civil Rights Act, any organization, like I said, that receives federal funding, either directly or indirectly, so if you're an OVW grantee, or if you're an OVC grantee, and receiving that funding directly, you by federal requirements are required to provide language access. If you happen to receive monies from your state administrator or through your coalition who's received money from the federal government, you are still responsible for ensuring that you provide meaningful language access. If you're an organization, let's say, I work with a lot of organizations that are, for example, social service organizations that have a DV program, and the only federal funding that they receive is specifically for that DV program. That organization is still responsible for ensuring that they provide meaningful language access. And that meaningful language access isn't just limited to that DV program that's funded by the federal government, but it actually extends to the entire organization. So the entire organization, by way of accepting those federal funds for that particular program, also is responsible for ensuring that everyone that comes to that particular organization has meaningful language access, not just that DV service program. And if organization receives interference, like I said, all aspects of that organization are obligated to take reasonable steps to ensure individuals with limited English proficiency have meaningful access. And so under the Civil Rights Act, the Civil Rights Act actually talks about that no person in the U.S. shall, on the ground of race, color, or national origin, be excluded from participation in, be denied benefits of, or be subjected to discrimination under any program or activity receiving federal funding. And so, you know, oftentimes people ask, so how does the Civil Rights Act actually relate to this language access provision and the provision of meaningful language access? It's because the language access component falls under the category of national origin. So based on your national origin and the language that you speak, you can't be discriminated against. You can't be excluded from participating in any programs. For example, let's say that you have a support group for English-speaking survivors. You cannot exclude a non-English-speaking survivor from attending that group. It's your responsibility to ensure that that person has equitable and has equitable access to those services, meaning that it's your responsibility to ensure that that survivor has access to that service. And that might mean, you know, having to find an in-person interpreter to be available during that group. That might mean maybe working with a telephonic interpretation line to be available, you know, on the phone during that group session. It's trying to figure out what is meaningful for your organization. Like, what is the things that you are able to do that are not going to put the organization under any significant stress or duress or anything like that. And again, just talking a little bit more about the requirements for those organizations who receive federal funding. And then we talk a little bit about, it's just the right thing for us to do. At the end of the day, because our work really is about making sure that survivors have access to services, that we're responsible for their safety, for their healing, for ensuring that they have access to justice, right? And it's also the ethical thing to do. Agencies and organizations who haven't had a chance to develop a language access plan often find themselves operating from this place of operating just reactively, right, when it comes to providing language access. And that's basically meaning that, we're responding to the needs of individuals with limited English proficiency when they come to us, like on the spot. And sometimes we just have to do that. We know that by the nature of the work that we do. But it's also very critical for us to be able to be prepared for those instances, right? So that we're not putting a new advocate to the organization in a situation where they might not be able to handle, or they're not used to handling, interactions with a survivor with limited English proficiency. What we hope to do by sharing this information with you all today is really to help, agencies and organizations to be proactive by having an effective language access plan in place prior to engaging with individuals with limited English proficiency. And, although we know that advocates have often been found to be very resourceful and creative, and we find creative ways to communicate with individuals with limited English proficiency, that relying on a patchwork of ad hoc kind of communication methods is guaranteed to at some point either make the advocates feel ineffective or frustrated, and often makes victims feel frustrated, isolated, confused, or just not supported overall. So it's critical to acknowledge that, our lack of a proactive plan for meeting the language access needs of individuals with limited English proficiency can significantly, again, just undermine meaningful access to services and support, and really compromise safety of victims and those options that are available to them. Also, it improves services and enhances outcomes. And what we've learned is we've done some research. We did some research at Casa Esperanza, the National Latino Network, oh my gosh, about 3-4 years ago with a national hotline. And we surveyed Latinas, or in Spanish-speaking individuals who called the hotline seeking help, and asked them a myriad of questions around their safety, how they felt when talking to someone who spoke their own language. Did they have a preference in terms of interacting with someone who understood exactly what they were saying and where they felt comfortable communicating with those individuals? And what we learned was that research shows that domestic violence survivors with limited English proficiency were more likely to seek out services if those services were provided in their language, right? And what this means is at least, what's meaningful for some organizations might be, something as simple as hiring a bilingual advocate, or contracting either on their own or with a state coalition on their language access plan to have access in that way. It doesn't necessarily mean that you always have to have staff members that speak Spanish or who are bilingual or bicultural, but it's about figuring out how are we able to provide services in their language to ensure that we're able to provide a certain level of comfort for those victims and survivors, and also being able to start to develop those trusting relationships to ensure that we're able to provide the best services that we're able to provide to those individuals. Language access also clearly enhances safety. If you consider that without it, the survivor can't interact fluently with the advocate and other service providers and systems. And that's why, it's a best practice to be able to figure out how to provide the best meaningful language access. Again, either by, in your own organization, by hiring bilingual staff, or by having access to that telephonic interpretation line. In a court, is more around ensuring that advocates are able to advocate and be sure to hold the courts responsible for providing meaningful language access. So courts are one of those systems that receive federal funding just like law enforcement agencies. They all receive some sort of federal funding for their operations. So it really is about building the capacity of our advocates to be able to hold those systems accountable when it comes to providing meaningful language access. Oftentimes we hear from advocates that, we went to court and the court says that they don't have an interpreter for the survivor, or that the survivor has to bring her own interpreter. And that's not the case. If we're able to advocate in a way that's effective, we'll be able to hold those systems accountable and being able to provide those services for survivors that they come in contact with and that we're seeking support and services for. And so before I jump into developing a language access plan, are there any questions up to now? Does anybody have any questions on the information that I've provided thus far? Okay, perfect. Well, I'll move right along. So a language access plan. So a language access plan is a strategy to assess, identify, and manage a system to ensure that individuals with limited English proficiency are able to fully access services and experience them as any other individual would. So it's really about, again, providing equitable access services to ensure that there's parity in services, to ensure that survivors with limited English proficiency are experiencing the services that you offer in the same way as, English-speaking individuals who seek your services. So it really is about providing a general overview of the components that are needed to develop an effective language access policy. And so what we'll be doing is we're going to talk a little bit about documenting your current language access practices and turning those into a formal plan. And so this overview that I'm going to share with you now really does provide a practical and easy to follow approach to help making language access planning less intimidating, because given the number of steps that it takes, it can sometimes be fairly intimidating for an individual. So what I'm showing here is just a quick graphic, just a quick overview of what the process looks like. I'm actually going to go ahead and break it down a little bit more for you. So before you even begin to kind of do this work, whether it's developing or revising a written language access plan, it's most efficient, and that's what I found as I was doing this work for CASA about 4 or 5 years ago. When we started developing our very own language access plan, I was actually tasked with putting together the language access plan, and I thought, okay, well, I've got this. I can go ahead and do this. I can knock it out in a couple of weeks, and I'll be good to go. And as I started kind of developing the plan and thinking things through, it kind of hit me that this is work that can't be done by just one person. So for us, what we've identified as a best practice is really identifying 4 to 6 staff members to be actively engaged in the process of developing the organizational assessment plan. And we want to be able to do that because it's critical that that we get organizational buy-in. So it's best to engage staff who are really interested and passionate about this work. And it's also really important to ensure the diversity of the group by identifying staff from across the organization with varying areas of skills and expertise. So for example, when we were putting our plan together, it was pretty clear to me that folks who needed to be involved in this team had to be folks who worked across different business sections of the organization. So I was fortunate enough to be able to recruit some staff from our family advocacy program, so our advocates. We recruited some staff from our national TA team who do national work. We reached out to receptionists. They're the first person that comes in contact with anyone who is limited English proficient, whether it be on the phone, through a phone call, or someone who might walk into the office. We also recruited our director of finance, because at the end of the day, we need to figure out how we're going to pay for language access, and how we're going to sustain it going forward. So it's really important that this work group that you bring together has a deep insight and fast access across staff. So consider everyone at your organization and kind of bring them together. Think about who needs to be at the table. Think about who's going to be the individual who's going to lead this initiative. And think about the responsibilities of each of the staff on your team. And also consider that your work group or your team needs to identify a lead. So the lead would be the person responsible for driving this process. To ensure the progress of the work group, to be able to communicate as needed with all the staff, to coordinate the development of the written plan. Also, if the work group has completed its assignments and worksheets, if they've met to review results and provide analysis. So actually someone who's just going to oversee the entire process, someone who is going to, with the help of the team, develop a timeline for the development or the enhancement of this plan, figure out who's going to be responsible for training, all of those great things. So I added a slide here just to give you some additional insight on some additional things to think about once you bring your group together. Something that we did is that once I was able to identify who the group of folks was that I needed to have at this table, we took the time to answer these 6 questions for ourselves. And we kind of made these 6 questions the foundation for the development of our language access plan. What are the benefits to increasing language access for the organization and for the service area or the community that you serve? How important are the services we provide to the lives of people who seek our services? What are our concerns about increasing language access? What does that mean? Is it going to cost us more money? Are we going to have more people seeking our services? What does that mean for us as an organization? So these are just here to help you think through those things a little bit more. And just additional added information: who is in charge? Who are you serving? Who pays for language access? So just so that we're clear on this, given the fact that the federal requirements are that anyone who receives federal funding is required to provide language access, what we often hear from folks is that, well, I don't have any money to fund my budget. Well, by the pure nature of the federal government giving you money to fund your program, the federal government expects, right, that you will utilize some of those monies for developing your language access plan, for the implementation of your plan, for any costs associated with an interpretation line, any costs associated with in-person interpreters, any costs associated with translation of documents. So it really is about working with your finance folks to figure out how do you make that happen. Where in your budget are you going to have to make some changes, or where do you have some flexibility to ensure that you're able to set aside X number of dollars to be able to support your language access initiatives? So the next step when you're thinking about developing a language access plan, and just remember that what I'm sharing with you here are the components to information gathering. This is all the information that you're going to want in front of you once you get ready to start developing your language access plan. So you'll want to identify the number or proportion of limited English proficient individuals eligible to be served or likely to be encountered by your program, and you'll want to identify who are the people in your community, in the community that you serve. And so you can actually identify those folks by a number of different resources, or accessing a number of different resources. The U.S. Census Bureau has tons of data. The only thing with that is that it's tons of data, right? So it's hard sometimes to decipher for your particular regional area or for your particular community. In that case, what I would suggest is, actually looking at local government data, looking at local school district data, also looking at your local hospitals. The majority of local hospitals and county-based governments actually have a language access plan, and many of them have those posted on their websites. And so, for example, if you were to do a search on languages spoken in Bethlehem, Pennsylvania, you might most likely find information that's provided both by the school district and by your local hospitals. And oftentimes your local hospitals will actually identify what are the top 4 or 5 languages spoken in that particular area. And so that'll help inform some of the information that you'll be gathering and helping you to identify who are the folks in your community that you need to be that you're providing services for. Also, you can identify languages spoken by those who seek your services. So really looking at the demographic data that you may already collect for reporting purposes for your funders, or just for reporting purposes within the organization. And so looking at, who you served in the past 2 years, for example, will give you an idea of who are those folks who are seeking your services and may help you to identify what languages they speak. Now, they might not necessarily tell you what languages these individuals speak if you're not already asking that question in your intakes, or if you're not documenting that information by way of conversations that you've had with individuals, but at least it'll give you an idea of the geographical areas where folks come from, which will help you to start thinking about what languages you might potentially be providing services for in your shelter or in your program within the past couple of years. So again, review your program's demographic data, pull numbers from all aspects of your program, whether it's the hotline, the shelter, any support groups, any outreach materials that you might have already translated, how many of those you're distributing a year. And that'll give you some idea of whom you might be providing services to already. And then again, this is just an extra slide with some additional information for you all to think about. Looking at who is your limited English proficient population, how is your organization serving limited English proficient individuals already, what trainings do you have in place for staff in terms of providing services to populations with limited English proficiency, what are your current policies and procedures. So again, just something to think about so that you have it when you're walking through this process. The next step, step number 3, really is about looking at your current language access practices. Like I mentioned earlier, even though we might not have them formalized in a plan, oftentimes many of us do have language access practices in place. So it really is about having conversations with your staff around when you encounter an individual with limited English proficiency, how do you provide services? What are you currently doing? Do you currently have access to a telephonic interpretation line? Do you have a process for reaching out to your bilingual staff member to come and help and support in that case? Kind of looking at those different things. Really looking at how you're currently providing services to individuals with limited English proficiency and kind of documenting what those processes look like. So if, for example, you're using a telephonic interpretation line, where is that number housed? Who has access to that 800 number? Has all your staff been trained on the fact that you have access to a telephonic interpretation line? Specifically, those staff members who may never encounter, right, an individual with limited English proficiency, but we never know if that's going to happen or not, right? I know that oftentimes when we're writing our plan, it would come up that what are the odds that our HR manager is going to have to provide services to someone who is limited English proficient? And we kept going back to, well, she works in the office, right? She can be walking out of the front door and an individual can be walking in. So our expectation as an organization was that the HR manager would figure out how to communicate with that individual, or at least know what it is they're supposed to do. Right, and that scenario could be something as easy as bringing the individual in, introducing them, as best you can to the receptionist being able, if they're not able to talk to them themselves, either locating a staff member who might be able to speak to them, or jumping on the line and calling the telephonic interpretation line to kind of figure out what it is that's going on. We ran into this a lot. The building that we're housed in St. Paul has a multitude of social service agencies within the building, and oftentimes we would run into, or we would have individuals come into our office from the Somali community, not necessarily looking for DV services, but just, looking for one of the other social service agencies within the building. And so part of our language access plan included, we were located right across an office for a personal injury lawyer, and he had staff who were Somali and who spoke Somalian. And so we had some conversations with him about, hey, this is what we do. Oftentimes we get members of the Somali community who come to our office seeking services, but we're not sure how to support them. So we want to make sure that, if someone comes into our office, if we might be able to, walk them over to your office or come over and have your staff come over and kind of interpret and help us kind of identify what services need to be provided for that individual. And that was a meaningful step that we took because what we knew was that a lot of the folks coming into our office were lost and not necessarily looking for DV services. So we wanted to ensure to be able to provide them with access to whatever services they were seeking, but also being mindful that knowing that we also had very limited resources available to us, and so that we couldn't be using our telephonic interpretation line for every individual that came into the office. So we would kind of work it in that way. If they weren't able to communicate with them, of course, or no one was available, we always did make that call to the telephonic interpretation service. But again, it's really thinking about what is meaningful for you and your organization, given the financial resources that you have available to you. And so here is, some additional steps that you can take in trying to identify your current language access practices. Some more information about things for you to think about as you're going through this process. Again, they're just here for your reference to help kind of jog your thinking a little bit and kind of help you come up with some additional information. Planning for meaningful access. The services that you provide are critical to the individual's safety and emotional safety. So you must take reasonable steps to ensure that individuals with LAP have meaningful access to your services. And so then we talk a little bit about what does it mean to provide meaningful access. And at the end of the day, meaningful access really is about thinking about what is feasible for your organization. What is it that you can do to ensure meaningful language access? It really is about looking at your current language access practices, like I mentioned before, and identifying what you're currently doing and how well you're doing it, and really looking at what can we do better and how can we do it better. But it's also the opportunity to identify what additional reasonable steps you as an organization can take into, or you can take in providing meaningful language access, whether it's identifying what materials need to be translated, right? So you'll conduct an assessment that you did in step 3, really looking at the community that you serve and who's come into your services, and really identifying which are the vital documents that I need to have translated into a different language. Since, a lot of the folks in the state of Pennsylvania, most likely that you might be running across, might be Spanish-speaking folks, it might be worth considering, what are those vital documents that we need to translate into Spanish? Is it your pamphlet, the services that you provide? Is it your intake form, if you're having somebody fill in their own intake form? Is it the order for protection process, right? And who's helping with that? Does your court have the OFP request form in Spanish, or is it only provided in English? So really thinking about, as an organization, what are those documents that need to be looked at in terms of making them more accessible to folks who come to your seeking your services. And also looking at, again, just hiring bicultural bilingual advocates is considered a reasonable step. hiring interpreters is considered reasonable, if you have the funding that allows for you to do that. For some organizations, given your current financial, situation and what is allotted or what you might be able to allot for language access, you might not be able to hire in-person interpreters. So then it's thinking about, are you able to contract with a language line? If you're not able to do that, then it's maybe looking at, what other organizations within the state might already contract with a language access line. Like, for example, in St. Paul, we, because I spit out, so we don't have our own telephonic interpretation line. It's very costly. We're a small program in St. Paul, Minnesota. But we're fortunate enough that through our state coalition, the state coalition works with a program called Day One. And Day One, they provide services, support services to member programs, CV programs across the state. And so Day One has actually, they're the ones who have the telephonic interpretation line, the contract with them, and we actually subcontract with Day One. So basically, Day One has provided us with the 800 number and our own code to be able to use the telephonic interpretation line. We use that as needed. So initially, we only use that line for intakes and crisis intervention situations. After we did our language access plan, or as we were doing our language access plan, we also decided that that line was also to be used for daily communication with anybody in our shelter who may be limited English proficient. And so we were able to then utilize that line where Day One would then bill us on a monthly basis for the times, for the total number of minutes that we use from that interpretation line. And I'm going to move here fairly quickly because I just realized that I don't have much time left. And so also, again, talking about what is reasonable, it's depending on the demographic assessment of your agency. So looking at who is in your community and who you're already serving. Again, it looks reasonable for every single organization. The level of language access that an organization must provide really depends on the demographic assessment and the most commonly encountered languages. And what we're looking at as, taking this floor-to-ceiling approach really is about looking at what can I provide right now? What is the floor? What is the minimal that I can do and yet provide meaningful language access? And then over time, incrementally work our way up to providing the ceiling, right? The most optimal language access, meaningful language access that we can provide. So it really is about looking at what can you do right now. If what you can do right now as an organization is to hire a bilingual staff member, and that bilingual staff member will help support the work with any individuals with limited English proficiency, provided that they speak that language, then that's your meaningful access. If you can't hire a bilingual staff member because you're working in a rural area, you're a smaller program, and you have access to contracting through someone else or working with someone else through their telephonic interpretation line, then that's your meaningful access. Meaningful access can be something as simple as ensuring that you have, bilingual posters posted in your office, that people know that you're willing to provide language access, and also helping people understand that when you say to them, I suggest that you have an interpreter work with you, then it really is about taking a step further and saying these services are free of charge to you because our language access services are free of charge. So it's very clear to help people understand that, because what we've also seen is that oftentimes folks will refuse to have an interpreter because they're making the assumption that they're somehow going to be financially responsible for securing that interpreter to provide services, right? Because we've seen that happen oftentimes as well. And again, just some more information on taking reasonable steps. Allocating and building resources, again, really thinking through with your finance folks, how much monies do we have available to provide language access with? I've seen organizations set aside $1,000 for their fiscal year and being able to work with that. We have set monies aside in our budgets for language access, and over the course of the year, we may not even touch those monies, right? Only because we're Latina serving organizations, primarily our staff are all bilingual. The times where we've had to reach out to hire interpreters have been in situations where we're first come, first serve shelter, meaning we provide services to anyone who comes to our shelter. And so we've had Hmong women from the Hmong community come to our shelter. We have had women from the Somali community come to our shelter. And oftentimes what we do is we've been able to communicate with them through the telephonic interpretation line. But we also do something that's called co-advocacy. And co-advocacy is where we have formal agreements with other DV service providers within our service area, the Twin Cities, Minneapolis, and St. Paul. And we work together with those organizations to provide co-advocacy. So in the situation where we had a Hmong survivor at a shelter, we used the telephonic interpretation line while she was there at shelter. We did the intake, we provided crisis intervention, and then to communicate with her throughout the day. So we have a cell phone, we would go up to her room, call the telephonic interpretation line, ask her how she was doing, making sure she was okay. And then in the meantime, we work with the Hmong American Partnership, which is a DV serving organization that works with the Hmong community. And we actually work with that advocate to provide advocacy services. So the advocate came to shelter every day to meet with the survivor. We shared information as far as, what we have noticed, what we've been talking with the survivor about, how she's been doing in shelter. So we did that work in partnership, and we do that quite a bit. And that's, and that's all in kind. There's no exchange of monies in those, in those situations, because it's something that we do for each other. A lot of the non-culturally specific organizations in the cities reach out to CASA oftentimes to provide that service when they have Spanish-speaking survivors staying in their shelters or who come to their programs, and they might not have bilingual advocates to help support them. So they'll also work with the interpretation line, any in-person interpreters, and then we also provide co-advocacy for that individual in shelter. So it's also not only figuring out what monies can be set aside, but looking at creative ways of being able to provide some of those services and being able to figure out what building of those resources might look like, whether it's, writing them into your RFPs as you're seeking funding, making sure that you include that in your budget lines as part of money that you would need to do, to provide effective advocacy for your constituency. Looking at, opportunities for funding, developing concrete short-term and long-term goals in terms of what this looks like going forward. Are you going to translate documents every year? Or are you going to just budget to translate documents every 3 years, depending on the need, depending on what you have identified in the shift in terms of who are folks who are coming to your programs? Has your community changed in any way that's going to impact what materials need to be translated, kind of really looking at all of those individual factors. And so once you've gathered all this information, is when you'll start looking at formalizing your plan. And so formalizing your plan, I highly suggest that you visit languageaccessplan.org. It's where our LEP toolkit is housed. And again, it will take you step by step. You can pick from how to start a language access plan. You can go to enhancing a language access plan, and it would take you through a very detailed process on how to take all this information that you've gathered and synthesize it and include it in this language access policy. So when you formalize the plan, it's really about looking at articulating what you're trying to accomplish, describing how meaningful access supports are connected to your organization's mission, articulating your reasons for establishing this policy, developing a concrete policy and procedures and instruct and guide staff. So not only will you highlight that, you're creating this plan because A, it's a federal requirement, and then the many other reasons why you might want to do this, but it's also looking at this as the template and the guide to ensure that your staff is able to provide language access in the most effective way. So once this plan is created, you're able to train your staff and build their capacity on not only understanding language access and what it means, but also on how they are to provide language access given the situation. Let's see what else. Also working with interpreters is one that you'll be able to identify, for yourself. What does that process look like? So do you have a process where your first, at first contact, your first step is to identify a staff member who might be able to take that call or support that individual? And if that's not available, what's your step two? Is your step two then to contact the telephonic interpretation line? If that's not available to you, then what's your step three? Is your step three then going to a pool of interpreters that you've already spoken to? So something that you want to do as you're developing this plan. Well, I lost my PowerPoint there. I'm not sure what happened, but there we go. Thank you very much. Also, so thinking about, assessing an interpreter skills, what I was able to do is I actually just called random interpretation services. And I came up with a list of questions of interview questions. And basically asking, for cost, what's your turnaround time? If I call you today, how soon can you have an interpreter out to my office? I talked about if we were to contract with you, are you willing for us to train your staff on DV and SA and maybe on some vicarious trauma and on some trauma-informed approaches, right? Because what we need to be mindful of is that oftentimes interpreters are not used to interpreting for DV or SA situations, right? And what we don't want to do is cause more harm. We don't want to cause any harm to the interpreter, and we don't want to cause any harm to the survivor who's utilizing those services. So it's really important that when you're thinking about reaching out to interpreters to identify who you might be able to contract with, for you to really be able to think through the list of questions that you want to ask. It's pretty much like an interview, right? I found oftentimes too that interpreter services, knowing that we're a nonprofit and knowing that we provide DV services, oftentimes would say, we'll do an agreement to work with you all, but we won't call it a contract, right? Because oftentimes with a contract, you have to pay for a certain amount of hours, or the expectation is that you would contract for 3 hours at a time, where we might just need 15 minutes to an hour. So kind of really thinking those things through. And as you're going through that process, if you have any questions, you can certainly reach out to me, send me an email. My email is at the end of this PowerPoint. There's a team of us of 3 or 4 on CASA's team that work around language access doing this work. So we'd be more than happy to walk you through that process, help identify, answer, address any questions that you might have, all that good stuff. Planning for implementation. So once you've gathered all this great information, once you start putting it into your plan, again, I'll refer to the language access toolkit that someone put out there, the link on. There's also, there's a template for your language access plan. It doesn't need to be anything super fancy. Your language access plan can be anywhere from 6 to 7 pages. It's just a plan to outline the why you're doing this, how it ties into your organizational mission, the steps that you're going to take into providing language access. What we did is we did 2 language access plans at CASA. We did a public-facing language access plan, which is maybe about 10 pages or so, and then our internal language access plan, which is about 30 pages. And what we did, since we have so many different components in our organization, we have our family advocacy, we have our community engagement work, we have our administrative office, we have our training and technical assistance arm of the work, we have our research arm of the work. So what we did is each manager or director in charge for those work areas then developed a protocol on how they would handle providing language access within their sphere of their work. So for example, our community engagement work, if we had a community engagement team at a local resource fair and someone with limited English proficiency, came to them to seek services, how would we communicate with them at that point? Given that we all have the 800 number, so we thought of a couple of things. The community engagement manager felt that, if it's a community health fair, for example, we would go to one of the other tables to see if someone can help interpret for us at that moment. If that wasn't possible, because for example, in Minneapolis, the Somali community is very small, and so we wouldn't want to risk confidentiality by, going to another community member to interpret. We would just pull out our cell phones, call the 800 line for the telephonic interpretation line, and kind of use it right there on the spot. So we provided that opportunity for each one of our different work components to come up with their own protocols for their work area on how they would handle working with individuals with limited English proficiency. And so when you're talking about implementing your plan, you want to look at, who is going to be responsible for what? Who is going to provide the initial training to staff? Or are you just going to train your leadership and then your leadership be responsible for training their staff? What do you do with new hires? Who's responsible for training them on the language access plan? Is it your HR person, or is it during the onboarding process, if you have someone designated specifically to do language access work, will they then be responsible for training those folks on your language access plan and your protocols and policies? Will you be including that language access plan in your new hire manual? How will you distribute that language access plan? Is it via email? Will it be housed on a server somewhere that someone has access to? When you, for example, enhance your plan, how are you going to communicate those changes to your staff? Is it going to happen at an all-staff meeting? Are you going to send out a memo? So kind of thinking about those things and what they look like. And then those are steps that you'll want to include in your language access plan under a heading called training of staff or something like that. How are you going to implement this plan? Who is going to be responsible for what? And how are you going to ensure that everybody is trained properly on your plan and protocols? And we talk a little bit about the plan, the training of staff. What is it that you're going to train staff on? You'll want to train staff on the federal requirements, the why we have to do this. You'll want to talk to them about it's the right thing to do, right? Because we're in the business of saving lives. You want to talk about how we go about identifying an interpreter, right? How do we go about identifying if the telephonic interpreter, if we have that gut feeling that they're not doing a good job or that they're not communicating what we're communicating based on the survivor's body language or the look on their face, or whatever. If for example the survivor is only saying 5 to 7 words to the telephonic interpreter, and what you get back is this huge story, well, that's kind of a red flag, because where did all this other stuff come from? So kind of helping your staff identify what it looks like to work with a telephonic interpretation line. Maybe even setting guidelines in terms of not using family members as interpreters, not using children as interpreters, not using other participants as interpreters, because, confidentiality issues, but also we want to ensure that the safety and well-being of those individuals as well. And then even thinking about advocates as interpreters, within the context of your work in community or in shelter. If that's what's reasonable for you, then fine. Then let that be what you do. But also be very clear with advocates that they're an advocate first, right? And so their job is to advocate for survivors. And so, in a court situation, you don't want to put your advocate in a situation of being an interpreter for the courts, because then they won't be able to effectively advocate for their survivors that's there to serve. It would be best, and I think on the LAP toolkit or on our national page, for the National Latino Network page, if you scroll down to the bottom, you'll see that we have multiple toolkits down there listed. One is the LAP toolkit, which I think the link has already been provided to, and the other one is a court toolkit. And that toolkit has been developed to build the capacity of advocates and their comfort level with advocating within the courts to ensure that survivors with limited English proficiency have access to those services and to be able to hold the courts accountable for providing language access so that advocates don't find themselves in a situation where they'll have to serve as an advocate and as an interpreter in the courts. Again, just some additional questions for you to think through as you're collecting data, as you're gathering additional information to help the facilitation of putting together your language access plan. Another component of your language access plan really is about identifying how are you going to let folks know that you provide language access. Is it just on your materials? Will you have a poster in your office that says, we provide free interpretation services? Is it training your staff to communicate that, with survivors or with communities when they're out doing health fairs or resource fairs, or where they're at different meetings across town representing your organization? So it really is coming up with a plan on how you're going to let folks know that you're providing the service. And just know that when you let folks know that you're providing the service, folks are going to come. So you'll need to be prepared to provide language access. So that's why it's critical to really look at and investing some time in identifying what languages are spoken in your service area, and really looking at a look at the demographic information of folks that you've provided service to in the past, and trying to figure out what's reasonable for you all. If you provide services, language access services in Spanish, because that's the largest population in your community, that's great. But who are the second and third largest populations in your community? And why are they not coming to you, right? Because they might not be coming because, you're not providing services, A, and they don't know that you're providing services. So how do you connect to those communities to let them know, hey, we're here, and we can provide services to you in your language should you need them. So that's very important to consider as well. So here's some ideas on how you might be able to go about reaching out to community and kind of sharing with them that you're able to provide language access services. Just some additional questions for you to reflect on and think about as you're working your way through this piece of the plan. And then monitoring compliance. So for those of you who already have a language access plan and are looking to enhance, what a critical piece, and this goes for both, I guess, both of you all, both sides of those, developing a plan for the very first time and those who already have a plan that they're looking to enhance, is really about establishing a process for revisiting your language access plan. Whether that's an annual review or you review it every 2 years, but really looking at, how have the demographics changed? So doing another community assessment, another community demographic assessment to see if there's been any shifts in the communities that you serve? You know, has there been a new refugee community who's moved in? Is there a new emerging community that you might have not noticed, you know, in years prior? You know, having conversations with your staff about how has your plan affected services? Has it affected services? You know, has there been an increase in services being sought by members of communities with limited English proficiency? You know, how did you address unexpected languages? You know, we do see a lot of organizations who are dealing with communities that speak languages of lesser diffusion. For example, within the Latino community, we have a lot of indigenous communities who speak indigenous languages, right? And what we've learned is that oftentimes we are not able to find interpreters for those indigenous communities, right? So in those situations, what do? Right? You know, I mean, we try our hardest to reach out to our network of folks across the country who work with interpreters, who work with different populations to kind of help identify if one of their staff members can help us out for a quick call, or if they know of any interpreters within their regional area who might be able to help. So really thinking about those things, you know, thinking about what you need to change or adapt for the next year. And once you make those changes, it really is about training your staff on it, letting them know, you know, this is what we assessed, here's what we learned, here's what we're going to do different, you know, and kind of providing some training capacity building opportunities for them around that. And then we talk about putting it all together. And so here is this link, and I'm going to go to this really quick. Can you all see this? Jackie, can you tell me if you can see this if I go to the link or not?
Yeah, it looks like it's saying putting it all together. It doesn't look like it opened up a link, though.
Okay, no problem. Okay. I apologize for that then. Let me go back here. Okay, so on this link right here, this is the link to our Language Access Toolkit, our LEP Toolkit. And as you can see right here, it shows Start a New Plan. So for those of you who are going to undertake this journey for the very first time, do not fret. There is help. So I would suggest that you start by clicking on Start a New Plan. It'll take you to a landing page that will take you step by step, all the things that you need to consider, from, you know, putting a team together, and it walks you through the entire process. So you basically just read along, click on the different links. They'll take you to additional information. They'll take you to example language. They'll take you to the sample LEP template. And by the way, the sample LEP template, I believe, is from the Kansas State Coalition. I believe everybody has used that template. So if you use it, you are in a great group, because I use that template for our language access plan. So, you know, you don't have to reinvent the wheel from scratch. There's plenty of templates and resources. LEP.gov is a great resource that you might be able to use as well. Then for those of you enhancing in language access plan, you can come right here and click on that, and it'll do the same. It'll take you to a landing page that talks specifically on enhancing your language access plan. It'll, you know, take you through all the individual steps that you need to think about, that'll help you in your planning, that'll help you in thinking through the steps you need to take place next. And then just in general, it's a great resource to provide examples of language plans, language access plans, some of the things that you need to think about. You'll find this information on the LEP template within that toolkit. And basically, you know, the first step is just your general policy statement. So as an organization, what is your organizational policy regarding serving individuals with LEP? Like, why are you doing this? How does this policy connect to your mission? Why are you establishing this policy? And then establishing some measures, figuring out how you're going to let folks know that you're providing these services. And this is just a sample. I pulled it straight out of the LEP Toolkit template. staff compliance, plan for improvement. There's even a section on definitions. So within your language access plan, you'll want to define certain key terms. You'll want to define what limited English proficient means. You'll want to define what meaningful access means to you. You might want to define what interpreter means, and what translation means, and what vital documents mean. So all of these are things that you'll want to consider including in your plan. And then again, they're all noted and identified in the Language Access Toolkit, as well as the Language Access Template that we have available there. And then these are just some samples. So this is what I showed in the two previous slides. So you have the general policy statement, your purpose and authority, language assisting measures, notification of language access assistance services, and then just some sample languages, some sample language for you to look at, figure out, yeah, I like it, I'll use it, or, oh, I can come up with my own language, however you want. It's just a guide, just to give you an idea of what those could potentially look like. And here's some more of those here as well, just some additional sample language here for you. And then the toolkits that we have, so the languageaccessplans.org gets you to our LEP toolkit and all the wonderful information there. If there's ever anything that you need on there that you cannot find, shoot me an email, give me a call. I'll be more than happy to help support you however I can. And then this is the other toolkit that I had mentioned earlier, which is our Language Access in the Courts toolkit. And it really is about helping advocates advocate for language access in the courts and how they go about that. There are some printouts that they can print out and take with them. And, you know, when they go to court and someone tells them, well, we don't provide interpreters, they can say, well, here, look at this paper. According to this, you have to provide interpreters. It's kind of a way of holding systems accountable. Right, and we created this toolkit specifically. We had done a survey of advocates around language access, and one of the things that came up for them was how do we advocate for survivors in the courts to ensure that the courts are held responsible in their responsibility to provide language access. And so this toolkit was created out of that. And so with that, that's all the information that I have. I apologize if I went too fast. I just wanted to make sure that I covered as much as I could. I am very grateful that you all, again, took your time to join me today. Any questions that you might have, we've got a few minutes. I am more than happy to answer those. Like I mentioned, next Monday, we're going to be hosting a Q&A call, so it's a training and TA call. It's open to whomever would like to join us. And it's basically a free-for-all. So whatever questions you have about what I've presented on today, what my colleague Jose Juan Lara presented on last month around culture and identity and language access, you know, any questions that you might have regarding anything related to language access, whether hiring bilingual staff or what your job postings should look like or any of that, you know, certainly join us on that call. If for some reason we're not able to answer your question on that call, we will certainly look into it and get back to you. We are actually working with Rosie Hidalgo, who is our direct supervisor, Jose Juan and I's direct supervisor, and she's the senior director of policy, and she is the language access guru. Anything that, you know, we don't know, we can certainly go to her and get you whatever information you need as it pertains to language access, any of the policies, any of the directives, you know, what's the latest happening on the Hill regarding language access. She is also a tremendous resource for us as well and for you all too. So with that, I'll wrap it up, and I think that's all I've got for you all. So thank you again. I greatly appreciate you all.
Thank you so much. I just wanted to say that there was a comment in the chat about language access in the courts, and it looks like Beth shared a couple of links here. Though Vince was asking what's the link for the court toolkit, so I'm not sure if that question is directed to Beth or to Lumari, so we can figure that out though, Vince. But if there are any other questions, like Lumari said, feel free to contact anyone from PCAR or Lumari, and we'll definitely get you the information. We hope that you can join us on Monday, August 6th from 2 to 3:30 p.m. for our third webinar about language access.
Perfect. And so thank you. I appreciate Beth. I'm going to look into that resource. So thank you very much for that. And then looks like, I thought that Vince was going to type something then. Okay. Well, thank you, everybody. Have a great rest of your day and have a great, wonderful rest of your week. Thank you.
Thanks so much.
Okay. Bye-bye.
Bye.